we have an on-site clinic for county employees and their families to go to for medical care. Last year or so, maybe late 2018, the clinic manager took the time to go to talk to each department. She wanted to know what would make the clinic more beneficial to us. I waited until after the meeting and I told her I was on Remicade, and she explained that she'd wanted to implement an infusion clinic, and for months she worked on it with her incredible staff. Today was the grand opening for the county's infusion clinic. After work I went by and I am so impressed and excited to get my next infusion. With setbacks, COVID, you name it, the staff has had roadblocks, but this week all their hard work is paying off in a big way. My infusion is expensive. This is not only a huge savings to the county insurance, but it's so much more convenient for all of us patients. Some are driving an hour to get infusions in Nashville and having to deal with traffic, parking, taking off work. Now it's convenient scheduling, plus we know and trust the staff. Seeing the project transform into the finished product today was very cool. Knowing your health provider is working hard behind the scenes to make your health care more affordable and easier to obtain is a great point. So thank you for letting me share that, and I'm thrilled that she shared that with us.
Yes, that's great. Thank you. That's some really good news. And then on the topic of the provider, I think Charlotte, we're going to feature in the next employee newsletter, right? She's going to be featured. And it might be a really neat, then maybe the next employee newsletter, we get maybe some pictures of the little infusion center or something like that. And if you want to send me a picture, I can include that in SLT also. Okay. Anybody have any questions about that? And I know we really haven't spent any money yet. We've just, I mean, they pretty much cut a door in the wall, right? And I don't know, correct. Sometimes during the summer we get leftover chairs from the schools if they get new furniture. So anytime I see those, I let Charla know, and she comes over. And I don't know if you've had any luck with some of the stuff that they've sent over. Because okay, good, because we'll grab anything we get. So
our comment has been is that we're making something from nothing.
Mm-hmm. Yeah, and we are literally. Yeah, so tables, chairs that come from the schools, they end up in our warehouse. We grab them. So that's great. Okay, thank you. Tommy, did you have anything else?
Nothing else. That was perfect.
Okay, great. Thank you.
Hey, Janine.
Yes.
If I could, I just wanted to add to what Charla said. I've heard nothing but great things about what they've created down there. The atmosphere, they said, is very relaxing and pleasant. They have to stay there, Charla, correct me if I'm wrong, 3.5 hours or so. Mm-hmm. So to make it such a pleasant atmosphere, I have an employee that's involved in that, and she was just thrilled.
Yeah, I mean, when you just think the improvement of quality of life of not having to go to Nashville and like say dealing with parking, there's so much stress sometimes just getting to Nashville with the traffic and whatnot. So that's amazing.
If I can add one more point, that our first person who received the injection, the sort of like our test patient who's been receiving it for several months, he came last night, and Mr. Kelly didn't recognize him. He said, "Is that the same man who saw us initially?" Because initially he had given up on his injections, which was basically a death certificate for him. But he was bubbling, laughing, and just talking about how wonderful it is that we offer this, and it's changed his life. So glad to be part of that, even ourselves personally.
Yeah, that's wonderful. Thank you. Okay, we'll move on to the next topic, which is Epiphany Copay Assistance Program update. Chris, we have your name next to that on the agenda item.
Okay, I'll launch right in. As all the members will remember, at the last meeting, we had Christine Johnson attend and explained some enhancements that they can provide to the PBM portion of the plan. And I think she had mentioned that what they did was they worked off a percentage of shared savings. And of course, we were all aware that they work off a percentage of shared savings on the original copay assistance program. I think that we're all aware of how labor intensive these type programs are. And I think she mentioned that they're in their infancy with Epiphany. And so as they continue to look at these programs internally, they have determined that they're going to have some additional compensation for their labor. And so what they are proposing is to put the plan in on 10/1 and to go with the 20% shared savings. And then on January 1st, they would like to add an additional charge of 30 cents per member per month. Of course, by that time, we'll have an idea of what kind of savings they generate. Of course, we can terminate the plan, that portion of the plan if we want to. I think we'll find that they way more than prove themselves. And even with that additional charge, it's a significant return on investment for the trust. And so really, unless we need to do something different at this point, since the cost arrangement is not changed until 1/1, we wanted to share this with you as soon as we became aware of it. And so that's really what we wanted to communicate. Jane, do we need to do anything else at this point?
I don't think so. I would guess at maybe a December meeting, we probably need to look at the savings that we've incurred from October and November, I guess, to decide if we want to go forward starting in January, and then an idea of what the actual cost would be to us to move forward with that. Does that sound fair?
I did want to mention that Christine felt really bad about, she just wasn't aware of the cost. And I said, be happy to communicate that for you at today's meeting. So anyway, she did send her apologies, but the program goes into effect on 10/1, and they would not make any kind of cost adjustment until potentially 1/1.
Okay. So will it be realistic for us to be able to look at some of the, see the recognized savings like in October and November, and then in December make a decision on moving forward before we incur that cost?
Yes.
Okay. All right. I think that would most likely be a good plan. Does anybody have any questions on that? I'm not seeing any. Okay. We'll move on to the next item, which is new business. Marcia, financial statement review.
Okay, so we have the June financial statement. So it's the last one for this fiscal year. You'll see there on the first page is the balance sheet. Shows the cash balance of $24.2 million. You'll scroll down. We did make our adjustment for claims and judgments payable for the year. It just went up a slight amount. You'll see their fund balance of $19.8 million. Liabilities and fund balance equal to assets. On page 2, we have the information for our the bank reconciliation. Page 3, we just show our participation numbers. Page 4, we have our medical data. And so for the year, we ended up with $62.3 million in expenses, $64.9 million in revenues related to the medical plan. So we ended up with our fund balance this year as compared to last year. We actually ended up with a little bit of an increase of $971,766. So that was good to see. And as we've talked about before, it's probably a result of not as many elective procedures happening in the last few months. And so then, the subsequent pages show the breakdown by flexible benefits and other insurance, and then our breakdown by employee or by group, school system, county group, county roads, retirees, COBRA. Like I said, pretty much ending up with fund balance comparable to, a little bit higher than the year before. Average expenses for the year this year ran $5.3 million a month, and average expenses in the prior year was $4.9 million a month. So I'm sure a lot of that is, all of the cost savings that we're putting into place. And so that's good to see. Helps us keep our increases down.
And of course, we will see, this was for June, which had no premium for the school system, correct, Marcia?
June,
Or do we get?
actually June did, it would have had the
Okay.
teacher. June would have been the last month I had the teacher. So July and August will usually is when we will see that dip before the.
Okay. All right. Thank you. Okay. Any questions for Marcia? If not, I'll entertain a motion.
This is Jeff Taylor. I'll make that motion to approve the financials as presented.
Thank you. Do I have a second?
Amanda Beck, I second.
Great. Okay. No further questions. If not, we'll go ahead and vote. Marcia?
Yes.
Mark?
Yes.
Amanda?
Yes.
Tommy?
Yes.
Leslie's still not here? Okay. Donna?
Yes.
Tim?
Yes.
Jeff?
Yes.
Kelly?
Yes.
John?
Yes.
Ed?
Yes.
Charlie, did I call your name?
No, you didn't, but the answer is yes.
Thank you. All right. Got off on my list here. Ed?
Yes.
Kay? Is Kay there? She may have lost.
Yes.
Okay, thank you. All right, so motion does pass. Financial statements, thank you, Marcia. Okay, reinsurance renewal, and this is the reason we are meeting today, is it's that time of year. Every year we look at our reinsurance for a renewal date of September 1st. So I will let Chris and Kim lead us through that. Go right ahead, Chris.
Okay. It's my understanding everybody would have received a PDF document that was titled Reinsurance, and is actually a little narrative to Janine dated last week. You can follow along on that PDF document, or Janine can share my screen.
Yes, can you go ahead and share it? Or do you want me to try and pull it up?
See if I can do it.
Okay. If you hit it, I've opened it up, so you should just be able to click share.
Is that it right there?
We have that's it. Very well done.
Okay.
Control.
Okay, so I'll launch right in. Now, there's a number of folks that have been on the trust for many years, probably very cognizant of what a reinsurance policy is. For some of the newer members, would you all like me to give you a little bit of background, or do you want me to just cut to the chase? I see a couple nods there. You want me to just give a little bit? Okay.
I'll say yes, a little bit of background, please.
Okay. Reinsurance is an underlying insurance policy for self-funded plans. So the trust plan is self-funded, which cuts some taxes and some other type costs. When you're self-funded, you don't have to adhere to insured regulations. Reinsurance protects the plan from one specific claim or multiple specific claims in a policy year. An example would be the trust has a $600,000 deductible. And so any individual claim that exceeds $600,000, the insurance kicks in and reimburses the plan for amounts over that deductible. And that would be if one person had that claim, or if 25 people had that claim in the policy period, which is 9/1 to 9/1. So it protects the overall cost of the plan by providing anything, reimbursement, anything over the specific deductible. Most all self-funded plans are going to have a reinsurance policy. Now, of course, you get to the size of the state of Tennessee where they have 300,000 members and they're spending, I can't remember how many millions and hundreds of millions of dollars. They may not have a reinsurance policy, but anybody the size of the trust typically is going to have a reinsurance policy. As Janine mentioned, the trust reinsurance renewal is 9/1. The reinsurance company is Blue Re. And Blue Re has requested a 13.7% increase effective on 1/2000. that increase represents a little bit less than $75,000 in additional premium for maintaining the $600,000 deductible. I'm going to mention something out about lasers in a minute, but right now they're asking for that type of an increase. We did bid the plan and we did not receive any competitive proposals. And we did go back to Blue Re and we asked for a reduction in their premium increase. And the underwriter was looking at that, followed up with him prior to our meeting, and he said, I haven't forgotten you, but we just found out that the trust had a premature baby. And I don't know if y'all are aware of the cost for preemies, but they can be very significant. So he did not have an answer for us as far as a rate reduction at the time of the meeting. We've made that request. We've also made the request about another cost containment factor maybe that would reduce the premium, raising a laser. And let me get into what a laser is. We had mentioned that the plan has a $600,000 deductible. Reinsurers, when they're aware of a member that has very significant claims issues, many times they'll put a laser or a higher deductible on that one individual. And so currently there is one individual on the plan, you'll see it right down there as footnote 2, that has a $110,000 laser. They want to increase that to $900,000 in the new policy period. So we've even asked Blue Re, hey, if we increase that laser to $1 million for that one particular person, would that help reduce the premium? And he said he would get right back to us on that. Lasers are important because if you don't do the laser, they increase the premium. Let's just say in this situation, your premium is right at a little over $500,000. You didn't have that laser, your premium may be $750,000. And if that particular person doesn't meet that threshold, and or you can imagine when somebody has that significant of cost, it's a very unfortunate aspect of the reality of healthcare plans is many times they pass. And so if you just increase that premium and the member was not still on the plan, you still got the expense. So lasers are really a good factor, a way to mitigate the additional cost. So let's see here. Let me get to my next note. I didn't want to miss things, so I made myself some notes. So when you look at the cost of a medical plan, the overall cost of the trust's medical plan, we're projecting claims to be somewhere around $65 million. Now, out of that $65 million, 95% of that is actual claims reimbursement, your members' claims. You've got about 3% of that cost would be Blue Cross administrative fees and Epiphany's administrative fees. And then the reinsurance cost is about 1%. So when we look at the numbers here, and we can see that in the first column there, you go down to line item I, estimated premiums about $526,000, and it goes to $598,000. That's big money, at least it is to me. But when you look at the overall cost of the healthcare plan, it's less than 1% of the piece of the pie. And so just kind of keep that in perspective when you're looking at these costs here. The other thing that comes into effect that impacts the plan a lot of times is you'll actually get reimbursements. So if you paid $500,000 in premium, and in the past, there's actually been years where you received more reimbursement than you did paid in premium, that really offsets your cost too. So it may look like you're paying $525,000, but if you get money back, the net effect is less than that. So that's kind of where it is. See if I can get this out of the way here. So you can see you've got the current $600,000. Blue Re's also provided options for $650,000, $675,000, and $700,000. And then if you come across on line item I right there, you can see what it does to the premium. And so the trust needs to make the decision if they want to stay with the 600 or if they want to increase the deductible amount and reduce the premium somewhat. That's something that we need to discuss. I think that what we could do today to accomplish what we need to accomplish is I think the trust would be in agreement that whatever you decide on, we go back to Blue Reed and say, okay, will you reduce, really don't even give them the okay yet. If the trust agrees, we would go back to Blue Reed, and if they say, yeah, for the, we stated it's 600,000, they reduce it, 2%, then the trust says, hey, renew with the best negotiated agreement possible. But I guess the trust has got to make a decision whether they want to go with the stay with the current $600,000 deductible or increase the retention for the trust and reduce the premium. Does that make a little bit of sense?
So, Chris, basically right now it's a little over 13.7 or 13.7% increase, which equals that like around 74,000.
Yes.
75,000 a year is what we're looking at as a total increase. If we were to maintain the $600,000 deductible. Last year, we went from the $500,000 deductible up to the $600,000 deductible. And last year, there was a significant premium increase. This year, although 13.7 sounds like a lot, when you look at our, as Chris has said, our overall claims, the 75,000 is a relatively small number.
This is Mark. So just to make sure I'm understanding, Chris, everything, if we went with the 600,000, everything would stay the same. The potential to use it, not use it, our cost is up by, as Janine said, about $75,000.
That's correct, Mark.
Okay. How many times did we have to use reinsurance during last year or the year that's just ended or about to end on this contract?
At this time, it's our understanding there's been no reimbursement to the trust. And our data is, I think, through July 1st. And so you've got 2 more months of claims. You've got one claim at, let's see, Kim, do you know that amount? One claim at, I don't know. Kim, you got the large claim report? You must be on mute. I found it.
Okay, I was just looking for it. I got it.
Okay, so year to date through July 1st, you've got one claimant at 800 and almost 809,000. You've got another claimant at 541,000. So either one of those could hit. The 809,000 is the one that has the laser. So in all probability, 2 more months of claims, you'll have some kind of reimbursement for that particular member. Now, whether the other one gets up above 600,000, it's hard to tell, but with a couple more months of claims, the potential is for the trust to receive reimbursement.
Yeah, and Mark, just to add a little bit more color on that, the large claim is the claim that we've moved off the med plan into the pharmacy plan. It's the Fabry's disease claim with the $1.2 million drug. It's a county dependent. So while we hit that 800,000 before we got them moved, the bulk of their cost will not be covered under this plan. First of all, because it has a laser, but second of all, it's not going to be billed under the med claim anymore, and we're doing it through the pharmacy benefit. And I think the savings is $750,000 a year or something for that claim. But it does make this renewal, just like when we talked about last year's renewal, a little complicated, and they're putting a laser on a person based on a drug that's no longer part of the med plan.
And that's a good point. And Tommy was proactive and asked if there was, something we could do there. We did go back to Blue Reed And we did go back to Epiphany. In Blue Re, it indicated that many times these types of things are communicated and put in place, and then they don't come to fruition. So they're very cautious. And when we interjected that with Epiphany, Epiphany concurred and said, yeah, a lot of times they do take a wait and see approach. So we did interject Tommy's directive, and at this point have not been able to get them to take into consideration that change.
Thank you. But in terms of understanding the 650, 675, or the other options, let's say with the $675,000 option, our premium would stay the same, but we're gambling. If we have one of these large shock claims that's over 675,000, then whatever 75,000 we were saving, we're going to pay out because we have a larger deductible. Is that correct?
Yes.
Very perceptive, Mark. And here's the skinny on it all. If you have no claims, you want the highest deductible out there because you have less premium. But if you have claims, the lower deductible is probably going to give you more reimbursement than you're paying in the additional premium.
So to follow that up, over the last like 2 or 3 years, how many times have we had to use reinsurance?
Typically every year there's some type of reimbursement. Now the tricky part of all this is these shock claims are not predictable. I mean, you can literally have $1 million claim tomorrow.
And the ones that are predictable are the ones they're putting lasers on. Am I right? If they see those trends, so they put a laser on that person because they know the expectation that they're going to continue to use these very expensive medications, and then they put a laser on them. It's kind of not fair because, in my opinion, because they see all of our data, so they have a very good way of, like you say, they don't know the shock claims, but they know all these other ones, and it's it's an interesting concept when you think about. We're getting this insurance, but they already know all the claim data on all of our employees. And they're just gambling on whether or not we have someone that is in a terrible car accident or like a preemie, those types of things. But they have a pretty good analysis of our employees and their family members by now. That's for sure.
Make sure I understand this. We pay, let's say we go with the $600,000 option. We pay $597,000, almost $598,000 in premium. But if we have 1, 2, 3, 4 shock claims, we pay the first $600,000 on one of them, first $600,000 on the second one. It's able to be used multiple times, correct?
Yes.
Okay. I mean, for me, I'm willing to make a motion that we go with the $600,000 with the stipulation that he tries to negotiate it at lower. And if he can get it lower, we go with the lower. But from a cost containment standpoint, I like the idea of our costs being contained at $600,000.
Okay.
I'll second that motion.
All right. Any other questions from the members about reinsurance? Again, this isn't effective September 1st, and we are asking the Fessendens to see if there's any other type of reduced rate we can get. Okay, we'll go ahead and vote then. All right, Marcia?
Yes.
Mark?
Yes.
Amanda?
Yes.
Tommy?
Yes.
Charlie?
Yes.
Donna?
Yes.
Tim?
Yes.
Jeff?
Yes.
Kelly?
Yes.
John?
Yes.
Ed?
Yes.
Kay?
Yes.
Okay, motion carries, and we will move forward with the 600,000 deductible with the specific lasers and with a 13.7% increase unless the Fessendens can work with them and get that amount lower. Okay, all right.
Jane, can I mention one other thing? I know that the the wellness, program has had some kickball teams and so forth. And so I'm going to make an analogy with a kickball team. Okay, so we're all on the same team, and we're not going to give our opponents the strategy of what we're trying to do here. So we're not going to tell Blue Ree at this point that the trust has voted to accept that. We're not going to say anything about that. We're going to try to negotiate this amount down some, and then we'll get back to them that afternoon or whenever we hear from him, that, yeah, they've accepted that.
Okay.
Okay.
This is Tim. Is it wise for us to post our minutes on the website if we're?
We don't have a choice. This is a public meeting.
Okay.
Mm-hmm.
So what's preventing Blue to look at our website knowing that we've already agreed to this?
There's nothing that prevents that.
Okay.
So we know
we've had the conversation, Tim, and we've already asked for this. We've already asked for them to reduce and to give us a reduction in cost if they can raise that laser. I guess I just wasn't going to actually mention it verbally until he gives us his response.
Yeah, I just thought it would be very helpful for negotiation wise if they didn't know we already approved the 600,000.
I don't know how proactive they are about checking for minutes and whatnot. A lot of times private sector companies aren't aware that these types of things are public. But again, the meeting is being recorded, so it will be placed on our website.
Okay. All right. Thank you.
Mm-hmm. Okay. Any other questions? All right. Next item on the agenda is the trusteeship guidelines. Donna did forward those to all of you. Item number 9 does cover the fact that members may succeed themselves for 2 consecutive terms. Donna, can you share with the group, do we have a few members that have hit the 4-year mark?
Yes, we do.
Someone? Okay. Would you mind providing that information?
Sure. Mark and Donna and Leslie all were finishing their first term and agreed to serve a second 4-year term, and by the guidelines, that's fine. And so that's why we've put that in there as a reminder of the guidelines for the trust members. But those 3 are beginning to serve their second term.
Okay, great. And thank you again for being willing to do a second term. I do think that continuity is very helpful for the trust. So thank you. Great. Well, that is all we have on the agenda. The next item is schedule our next meeting. I do believe we could possibly hold off. We could possibly hold off till maybe the beginning of December, unless someone is aware of anything that would prevent us from doing that. And I'm thinking if we did something in December, then we could revisit the Epiphany with the copay assistance that they're working on, and we could determine in December then if we wanted to move forward with when it starts, when there is a cost to us. Does that sound good to the members? I know December sounds like a really long time from now, and hopefully we'll get to meet in person. If we, for some reason, receive an appeal or some other issue does come up, we may have to go ahead and schedule before December, but let's go ahead and plan for a December meeting. I know we've met several times this summer. Trying to remember, are Tuesdays good for the group? I was looking at December 8th. That's the second Tuesday in December. I'm not hearing any concern, so why don't we plan for December 8th? And we generally do, Donna, remind me, do we do 4:15 or 4:30 or 4?
4:15 usually.
Okay, is that still good with everybody? I think for those of you that are at late schools, that still gives you time to get over here to Gracie Avenue. Okay, and we will hope that we're in person by then. But so I'm going to have Donna think really positive and have her reserve a room for us. And we will plan for December 8th at 4:15. So I believe that brings us to the end of our meeting. So again, thank you very much for all of you that have taken time to participate in the trust meetings. I know we've had several of them this summer via Zoom. So I think that's been very successful. And we will go ahead and end the meeting. And again, thank you to Kim and Chris for all the work helping us with the renewal process for reinsurance. I know that it is a lot of work and we just see the end product. So thank you for crunching those numbers. We appreciate it.
Thank you.
Everybody have a great day. Talk to you later.
Thanks, everybody. Goodbye.
Bye.